respiratory medicine week. This week is all about the lungs. We're gonna listen to some lungs today, so let's go. Oh my gosh, I've done a lot already and it's just lunchtime. It's a ward round with the doctors, which it's just a lot of like observing and stuff. They can ask you some questions sometimes, but that can be quite intimidating. And then I took a history from a patient that has suspected TB. Look at me, I'm not even scared. I wore my mask, don't worry. And I took a history from the patient, but this patient was literally crying. And I feel like she's just been in and out of hospital for so many times that it's just been difficult. And she was just like, you're the first person that has even asked me these questions. And I was just like, oh my gosh, how do I handle this? What do I do? She's crying, where is the tissue? Guys, guess what? I'm in scrubs today, guys. It's scrubs and afro. I'm loving it. So today I'm, like I said, I'm in rest, and today I'm in the endoscopy unit. I'm excited. I'm hoping to see a pneumothorax today, guys. I know it's bad for me to be hoping that somebody's lungs has collapsed, but it would be so cool to see a chest drain. This is today's office. Very high-tech stuff. The first thing was just bronchoscopy, which is just basically, again, putting the camera down the patient's throat, and ultrasound as well, which is quite uncomfortable, but we sedate them and we give them a lot of medicine that will make them go all whoopy so they're fine, and then taking biopsies, so inserting needles into the nodes that are in the chest to take out some biopsy, which was really cool. The one I really liked was chest drain. So a patient fell and I think some broken ribs, and then because of the broken ribs there was a lot of blood pulling in the patient's lungs, so there was literally a whole bag of blood we drained out of the patient. You guys remember the patient I talked about yesterday that I spoke to that was very emotional, very teary. The patient already had a pneumonia, which is being treated, but we did a flush out to basically get some cytology to see what's going on there. But because the patient had suspected TB, we had to be fully gowned, so mask, everything, gloves. Oh, honestly, it was so difficult for the patient. I literally held her hand through it just to help her, encouraging her and stuff. Guess who finally saw a pneumothorax? And when I came for this week, I said I want to see pneumothorax. I mean, I know it's not good for me to be happy that someone had a lung collapse, but I just really wanted to see a chest drain, and I got to see one today. I got to observe, I got to help the doctor. Look at me, this is my pneumothorax stance. Hey.